Many investigational strategies in combination with CDK4/6 inhibitors are being tested. Very few have been reported so far. We did report data from the combination of everolimus with CDK inhibitor ribociclib from the Trinity-1 study. This was presented by Stacy Mulder and colleagues, and it did show a PFS of roughly around 4 months. So it's hard to know exactly. That was just a small phase 1 study, but we have to be cognizant that patients who progress very early on therapy may be different from the patients who progress later, because those that progress very early within the first, say, 6 months may have intrinsic resistance and may be very different biologically than patients that, say, progress after 12 or 18 months. So this is something that we're going to have to take into account. Other combinations that are being tested right now are in HER2-positive breast cancer. Patients with metastatic HER2-positive breast cancer that finish their induction therapy with chemo and trastuzumab, pertuzumab are then being randomized in one study to palbociclib versus control therapy, and we're going to look at the progression-free survival, and there are others as well. The other thing about CDK inhibition is it does seem to stimulate certain aspects of the immune system. So there are some early studies now that are looking at combinations of abemaciclib and pembrolizumab, for example, that are reporting promising results, and ultimately randomized studies will be done to look at those combinations.